Swadikap, and good afternoon once again. Today is Friday, the 23rd of July, 2021. And this is the English language summary of the daily press briefing here at the CCSA. So first, thank you to Dr. Apisamai for the Thai version. We also had the official from the CDC, the Communicable Disease Department of the MOPH as well, giving us some updates on the situation, as well as the unintended effects of the vaccination. So I'd like to start off first with the vaccination progress, updating on the numbers that we have administered since the start of the national vaccine drive. Yesterday, we administered 304,243 doses of vaccine. And you can see the breakdown of the vaccination yesterday into first doses and second doses. The Public Health Ministry is closely coordinating with the 6 COVID-19 vaccine importers as well to finalize procurement plans for next year to better cope with the unexpected mutations. And the CDC Director General said that the National Vaccine Committee has resolved to procure a total of 120 million doses of vaccines next year, comprising mRNA type, viral vector, and inactivated vaccines. The Director General of the CDC also indicated that the Ministry of Public Health will also discuss procuring other types of vaccines, including protein-based and subunit vaccines. Now, apart from vaccines, as you may have heard in the news, Prime Minister Prayut Chan-o-cha had instructed authorities to set up a committee to study the use of Fa Thalai Joan, green shireta, extracts to treat COVID-19 patients with mild symptoms, and to draft up a comprehensive plan for the use of this Thai traditional herbal medicine with a view to guarding against the spread of COVID-19. Now, for the numbers that we have for today, the general situation for today, we have new confirmed case standing at 14,575. Of this number, 1,072 are inmates in prisons. Now, we have the active cases currently being treated at 143,744. While new recoveries recorded today is 7,775. New fatalities standing at 114, making the cumulative fatalities 3,811. The fatality rate in Thailand remains at 0.85%. Now, with this situation of high numbers each day that we have seen for a matter of weeks now, the infection rate, of course, obviously in Bangkok continues to rise, being the center point of this. The Bangkok Metropolitan Administration, or BMA, had issued on Wednesday another announcement on the temporary closure of premises or businesses that have high risk of spreading COVID-19 as a precaution. These include all types of sports venues, sports fields, public parks, trade fair centers, convention centers, exhibit halls, learning centers, science parks, galleries, public and private libraries, museums and historical sites, early childhood development centers and preschool child development centers, beauty salons and barbershops, tattoo parlors and piercing shops, manicure and pedicure shops, swimming pools for sports and marine activities, public pools and similar businesses. And this order is in effect from the 23rd of July to the 2nd of August 2021, subject to further extension. Now, in addition to the suspension of flight services, domestic flight services for the dark red zones, Thailand state-run transport company has also suspended bus services on the northern, northeastern, eastern, and southern routes, except parcel deliveries until the 2nd of August as well. And those who bought tickets in advance for trips can seek refunds or postpone their trips, and more information on their website. And you have an infographic there, courtesy of the Public Relations Department. Now, for vaccination for foreign nationals that we have been announcing and keeping you up to date, I'd like to start off recap first of the one in Bang Sue Grand Station in Bangkok, because there had been some slight confusion regarding the arrangement. So 2 days ago, when we talked about this, we were talking about that foreign nationals who are 60 plus can register for vaccination, and the appointment date would be in a matter of days only. And that has been going on since it opened. And foreign nationals aged 60 plus had been receiving these appointments and arriving at Bang Sue Grand Station for such appointment. Also, for foreign nationals who are 75-year-old and over, who have never received their COVID vaccination, they can just walk in to Bang Sue Grand Station in Bangkok. We're giving priority to this age group to receive vaccination at the Bang Sue Grand Station. This is in line with our vaccine rollout priorities to inoculate those in the high-risk group first. And the 60 plus and 75 plus year old group for foreign nationals, this is for those who currently reside in Bangkok and the surrounding provinces. So what happened was that there was some misunderstanding that there were foreign nationals younger than 60-year-olds turning up to walk in at Bang Sue to receive vaccination. So please mind the details that we have to avoid overcrowding, to avoid crowding and further risk of transmission. We kindly ask that all foreign nationals of other age groups lower than 60-year-old plus, 60 plus, to not show up at Bang Sue Grand Station without prior appointments for the time being. So 60 plus, appointment first. 75 plus, you can walk in at Bang Sue. If you're under 60, this is not a scheme for you yet. For foreign nationals aged 60 to 74 in Bangkok, Samut Prakan, Samut Sakhon, Pathum Thani, Nonthaburi, and Nakhon Pathom, who've never received the vaccination. So this scheme is for you to register for vaccination at the Bang Sue Grand Station. This is a Ministry of Foreign Affairs and Ministry of Public Health collaboration, the online platform that we had announced as per the QR code, which I think we can show that on screen as well. Now, for the other groups, we have, of course, various vaccination options. Now, if you recall, we had the Thailand intervac.com, wherein that portal will lead to the pre-registration websites of various private hospitals. So it's linked to the Thailand intervac.com portal that had been announced already. So just a reminder to all foreign nationals of all age groups residing outside Bangkok and the surrounding areas, the registration for vaccination with hospitals where you have prior medical records at the earliest convenience. That's very important. For ThailandIntervac.com, the pre-registration is open to foreign nationals in the following category: 60 years and above, and people with the 7 underlying diseases: severe chronic respiratory disease, coronary artery disease, chronic kidney disease, cerebrovascular disease, cancer patients receiving chemotherapy, diabetes and obesity, as well as pregnant women in the gestational age, which is 12 weeks or above, who have a medical certificate from the hospital confirming that vaccination is allowed. So for these groups, you can go to thailandintervac.com and you will be led to the designated private hospitals that are linked with thailandintervac.com. These hospitals currently available for pre-registration to date now include Samitivet Hospital in Bangkok, as well as B&H Hospital in Bangkok. Now, all these are part of Thailand's national efforts, continuous efforts to ensure that all foreign nationals on Thai soil, living on Thai soil, will be given access to vaccines in accordance with our national vaccine campaign. So now I'd like to move to the Andaman Sandbox. The Tourism Authority of Thailand, or TAT, had revealed that Phang-nga and Krabi provinces are preparing to welcome tourists in the Andaman Sandbox scheme, which is scheduled to launch on the 1st of August 2021. If you recall, this follows suit from Phuket and Samui. The proposal for this sandbox scheme was submitted to the Center for Economic Situation Administration for further consideration last Wednesday. And if the scheme goes according to plan, the Phang-nga and Krabi provinces, which lie along the Andaman Sea coastline, will be the next to reopen to foreign tourists following Phuket and Samui. And the TAT governor further revealed that once the Andaman Sandbox is approved, the TAT will ask the cabinet to approve similar schemes in the future for provinces and cities and areas such as Chiang Mai, Pattaya, Buriram, Phetburi, Prachuap Khiri Khan, among others, in time for an opening in the month of October. But of course, this will be assessed according to the situation at hand at that moment as well. We're keeping tab with all the information, all the updates. Of course, we know that we have a very high daily number these days in Bangkok and the vicinity in particular. But in other provinces, the situation might be different. And if the control and the enforcement of inbound passengers and tourists, and if the locals are vaccinated to a very high percentage, that would be some of the considerations in reopening some of these other provinces for bubble kind of controlled visits for tourists by the month of October. So rest assured that all of the information that we analyze will be put in good use and for the consideration of these opening of the various provinces. So today I'd like to show you some infographics on the procedures for home self-quarantine as provided by the Ministry of Public Health. So these useful infographics also made available in the languages of our neighboring countries, in Burmese, Lao, and Cambodian languages. If you have to self-quarantine at home, in the case that you have been found positive and you are awaiting for a hospital bed or treatment from a medical facility, you are advised to do the following according to the infographic on screen. Firstly, isolate yourself from others. Secondly, frequently wash hands for at least 20 seconds at a time. Thirdly, wear masks and stay 1 to 2 meters away from others. Fourth, use separate personal items such as towels, drinking glasses, and utensils. Fifth, eat food separate utensils from others. Sixth, when coughing or sneezing, cover your mouth and nose with tissue. 7, do not go to public places, obviously. 8, clean accommodation belongings within the accommodation with detergent from time to time. And 9, avoid staying close to the elderly or people with any chronic disease. 10, discard masks with the method fold, roll, put in the bag, and wash your hands. For migrant workers from Myanmar, Laos, PDR, and Cambodia, the COVID-19 hotline is 1422, as appeared just now on the infographics. So this is what I have for you today. I hope you have a very healthy weekend ahead. The numbers are quite high. We are on it. It is very worrisome, but our team, our staff, all of the rapid missions, the rapid groups, mobile groups, all of the doctors, medical personnel, we are at hand 24/7. Dr. Pisamai also mentioned about the upgrading of the various field hospitals as well, that some field hospitals that had been receiving yellow patients, meaning those with not severe symptoms, might be upgraded to be able to handle patients in the red category, meaning patients in the with severe symptoms. So this is all work that is ongoing. We hope for and we hope and we pray that the situation will get better. And we thank you for your support and confidence. So let's all work together, and let's continue to fight COVID. So thank you very much. I hope you have a very pleasant Friday and then weekend ahead, and we'll see you again next week. สวัสดีครับ